Ever wonder how healthcare works across the pond? Today, we're diving into European healthcare systems, exploring the different models, how they work, and what we in America can learn from them. Let's cover the basics. Across Europe, healthcare systems differ, but the core idea is the same. Everyone contributes to support each other. It's a community-based approach for universal care while managing costs. Most European countries use a few main models. There's the beverage model, funded through taxes and provided by the government. In countries like Italy, Spain, and Denmark, care is free, with government-owned hospitals. Then there's the Bismarck model in places like Germany, Austria, and Switzerland. People pay into insurance funds that cover their care. It's still universal, but structured differently. Some countries mix the two models, blending public funding with private delivery for equity and efficiency. So how do countries put these models into practice? In the UK, healthcare is publicly funded, meaning it's paid for through taxes and available to everyone. The National Health Service, or NHS, is administered by each country and provides care that's free at the point of use, so patients don't get a bill when they see a doctor or visit the hospital. The system puts a big focus on primary care to keep costs down and make sure people get the help they need early on. This approach has helped reduce preventable deaths and improve overall health outcomes. Now let's look at Germany, which runs on a multi-payer system, meaning health insurance is mandatory for everyone, but there's a mix of public and private insurers. What makes it interesting is that people can choose between over 100 non-profit sickness funds, all competing to provide the best coverage. That competition helps keep premiums reasonable and quality of care high. Even though there are many insurers, the system is highly regulated. Providers typically follow standardized contracts, which helps streamline billing and reduce administrative overhead, something we struggle with a lot in the US. It's a great example of how you can balance choice, universal access, and cost control without sacrificing quality. France offers another interesting model, and it's often cited as one of the best in the world. French healthcare is predominantly tax-funded with a strong emphasis on patient choice. Patients can choose their providers freely, and the government reimburses a significant portion of the costs. This blend of public funding and private provision leads to high-quality care and high patient satisfaction, all while keeping costs relatively low. Scandinavian countries like Sweden and Denmark combine tax-funded systems with decentralized management. These countries invest heavily in digital health and robust primary care networks, ensuring seamless care coordination. Their focus on public health infrastructure and early intervention has resulted in impressive health outcomes despite lower spending. Let's take a look at how the US compares. Unlike many European countries that treat healthcare as a public service, America uses a market-driven system. Here, health insurance is often tied to jobs, causing gaps when people switch jobs or lose employment. Government programs like Medicare and Medicaid exist, but they have limits on who they cover. The US is a leader in medical innovation and technology with top-notch hospitals, advanced procedures, and pioneering research. But this all comes with a high price. Americans spend double on healthcare compared to Europeans, yet European countries strive for universal coverage with equal or better health outcomes. Then there's the complexity of the system. Patients face challenges with insurance networks, prior authorizations, out-of-pocket expenses, and unexpected bills, also adding to the administrative burden for providers. So while the US shines in innovation and cutting-edge care, there's much to learn from Europe, particularly in making healthcare more affordable, accessible, and straightforward. What can we learn from Europe's healthcare systems? Many European countries ensure universal access, viewing healthcare as a right. Strong government oversight leads to better pricing and outcomes. They emphasize preventive care, catching issues early to avoid costly problems and keep people healthier. For payment, they prefer value-based models like capitation and bundled payments, rewarding results over volume. They also focus on primary care and digital infrastructure, reducing duplication and managing chronic conditions effectively. In the US, we can learn about financing, access, and system design from these approaches to create a high-tech, accessible, affordable, and people-focused system. If this was helpful, like, comment, and subscribe for more on transforming healthcare.